I went and visited my gynecologist, and they diagnosed me with uterine fibroids. And they said I had a very large one, actually, about the size of a grapefruit, or a little bit larger. And they said actually that my uterus was the size it would be if I was 4 months pregnant. So I was pretty uncomfortable.
Myomectomy is a procedure where we try to remove uterine fibroids from the uterus. Fibroids are smooth muscle tumors. They're almost always benign tumors. Myomectomies are typically reserved for patients that want to maintain their fertility, and there's occasionally patients that just do not want to have a hysterectomy but want to get rid of the pain or the bleeding.
It was actually a lot of discomfort, especially with my menstrual cycles. I was having very heavy bleeding, very severe cramps. It was just really uncomfortable. I felt bloated all the time. And I was noticing that my stomach was actually getting bigger as I went, and this went on for about a month or two.
You can do open myomectomies where you make an incision and you try to maybe elevate the uterus out or retract over to where you can see the fibroids, remove the fibroids, and sew it up. And bigger fibroids, it's harder to do a myomectomy through a small incision. So if you have a big fibroid, you usually end up with a bigger incision. The advantage of doing it robotically or laparoscopically is that you do it through small incisions. So you do them through 4 small incisions versus 1 bigger incision. And the recovery is usually quite a bit quicker.
He said, yeah, you do have a pretty large fibroid, and we do need to take it out because that's kind of literally sucking the life out of you. He made 5 incisions on my stomach, and so there's very minimal scarring, and it was supposed to take 2 hours. Unfortunately, he found that behind the large fibroid there were 3 more fibroids, and so it actually took 4 hours. Once it was over, he came out and explained everything to my parents who were there, and he was able to save my uterus, which is wonderful. So that was a huge burden that was lifted because of what Dr. Allen was able to do.